You can start.
Mm. Hello,
Hello.
I am Dr. Gabra, the doctor in the general medicine of the outpatient clinic. Are you Mrs. Selina, 35-year-old?
Yes, doctor, I am.
Well, I understand that you came here with uh, some rash in the face and joint pain. Is that correct?
Yes, doctor, I had those, and after coming to my GP, he sent some investigations, and after that, he sent me to discuss with your clinic, and I am here to know that what the test results came out.
Okay, fine. So we are here. We are here today to discuss the result of your investigation and what we can do further. Is that okay with you,
Yes, doctor, I eagerly want to know that.
Mrs. Selena? Do you want anybody to attend our meeting today?
No, doctor, you can tell this to me.
So how are you feeling now?
After taking some painkillers, I am feeling somewhat better, but the rash hasn't gone away, doctor.
Okay, fine. So all the lab results are with me now, and I have the results. And the results showed that you uh, you are suffering of the condition called SLE, systemic lupus erythematosus. Did did you ever heard about it?
No, doctor. What is this? Is it a cancer?
No, it is not a cancer. It is a it is an disease in which there is defense in our defense system. In your case, the defense system attack our own body. It attack your skin and some part of your body. Uh,
So why I have this condition, doctor? Is there any reason
uh,
for it?
this disease can cause by multifactorial issue. It could be related to some family history, but it could be related to the uh, lifestyle. There is many reason for that.
Right? Is it a curable condition?
Miss Selena, I'm sorry to tell you that this condition it's not curable, but the good thing that we can treat the condition and we can control all symptoms. There is treatment available, and we can control all symptoms, and you can live near normal person. And many people with this condition, they practice their life without any problem.
Okay, doctor, and you said me that it is problem in my defense system.
Yes.
So is that mean that I am having a condition like the people called that is called AIDS? Is it something like that?
No, no, the AIDS is something else. This SLE, with is systemic lupus erythematosus, it's the totally different condition. There is some defense in your immune system, but it it doesn't cause reduce in your defense system. But your defense system attack mystically some part of your body, but it doesn't cause reduce in your defense system like disease AIDS. Did you get me?
Sure, okay, doctor. It is somewhat scary. So, can it affect my heart? Can it affect my kidney? Can it affect my brain?
Yeah, and unfortunately, this disease attack many parts of the body, including the kidney, the heart, the lung, the joint.
Mhm.
But the good thing that you are in good hand. We will you follow up you closely, and we will monitor your symptom, and we will control your symptom by medication.
Doctor, that is somewhat relieving news. And you said that it is familial. So will I pass it to my son? I have a son of 3 years.
It's not going. It's not like other disease which is run by family, but there is some report cases that it's when somebody has this condition, the children will have higher chance to have the same condition.
Time up.
Okay, it's very short,
Yeah.
very short time. Should I discuss here the treatment option?
No, your task was to explain the diagnosis only. And even if she asks any question, then you will explain. You will ask her because you will not get lot of time. And after uh, explaining everything to her, if if she doesn't have any question, then you can go for that. And treatment option isn't just informing her that we are going to inform the multidisciplinary team that we are going to involve the bone doctor, sorry, joint doctor, skin doctor, and blood doctor, and your GP, and they will combinedly take decision on your case.
Mm.
We will come with next cases. Okay, but for this, I think you could have make something clear before clear this when explaining because your main task was to explain the diagnosis. So I think you should have spent a little bit more time on the explaining the disease condition. Okay, you could have drawn some picture, or you could have make some time on that, like explaining that okay, our I have heard I have learned this way, that is okay, you know that our defense system attacks against the bugs, but sometimes our defense systems mistakenly can attacks against our own cell. Do you get me? Sometimes these cells can affect the skin. Sometimes they can affect the bone. Sometimes they
Yes.
can affect the blood cell.
I should explain by myself, not to wait surrogate to ask again.
Yes. No, 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 not like that. Just making her clear that it is something problem with the defense system and it is a autoimmune condition. So yeah, you
Mm.
cannot tell her this is autoimmune condition, but you should have explained this way that it is an autoimmune condition. So you are going to explain that in a more details. You took a very little time, and I was someone expert in this condition, so I could have understood that what you are wanted to mean.
Mm.
Okay, so, on the main task, I just spent a little more time. Even if you think that you can have to draw a picture, then you can draw it. And,
If I draw, it will take more time, right?
not more time, it will just add more 10 seconds, but it will make it clear to the examiner, clear to the candidate that yes, you have tried your level.
And they don't provide paper and pen in the communication.
Okay, there will they said that there will they will provide paper there.
They provide only in the long case. In the short case, they don't provide.
Okay, then uh, then we can tell her that if you then we can just only explain this. Okay, actually, your explanation was fine. Just giving her little bit more time would remove the confusion that you are asking about autoimmune condition, not just it is a problem in the defense system. That is not immunodeficiency.
Mm.
Okay. Otherwise, your explanation was very fine. And when the cause is most likely unknown, but there might be certain risk factors that can increase its chance. That is some type of bug, some type of chemicals, sometimes some history present in the family. And familial also is a medical term. You cannot tell it familial condition. You either you say that
One
this
by family.
condition runs in family or present in family.
Yeah. Yes. And should I ask in the Irish communication for smoking and alcohol and job
We
and
don't have
social
time for that.
Mm.
And
And
our task is very specific, and we need to go specifically that we are clearing our task, and after that if we have time related to this, then we will go for that, because we are not managing her.
should we offer community and social group at the end
For
and
this,
leaflet
when
and
explaining the diagnosis, obviously you can only offer that, okay, I can give you some leaflets and some website address, you can get a better idea about this condition. Will it be okay for you? That will give her a huge explanation and huge.
because I felt that I don't complete my station because of time short.
Okay, well, we will manage it within the short time. Okay, and make
Mm.
and practicing will make it, because we are total we are everyone new to it, so it will take time to be accustomed with it.
Okay.
I'm sending the next page. Okay.
Okay.
Okay. Start.
Hello.
Hello.
This is Dr. Gabra, the doctor in the General Medicine Outpatient Department. Are you Mrs. Selena, 35-year-old?
Yes, doctor.
Well, I understand that you are suffering of condition called systemic lupus erythematosus, and you came now uh, with a new symptom. Is that correct?
Yes, doctor. This time I am having severe pain in my hands, and also this time my water work isn't so good, and my GP suspect that it is a severe form of my condition, so he sent me here.
I'm sorry for that. So we are here today to discuss your condition and what we can do further. Is that okay with you?
Yes, doctor. I really want to get rid of this condition.
Okay. Do you want anyone to attend our
No,
meeting today?
doctor. Just you can discuss this condition with me.
So how are you feeling now?
Doctor, I am I have so pain in my hands, and that is not well controlled with my previous medication. And also, I feel that my water work has become somewhat very frothy.
I'm sorry about that. Don't worry, Miss Selena. We will work with you to reduce your symptom. And for that, our consultant review your condition and suggest the treatment for you. Uh, do you have idea what treatment suggested by your doctor?
No, doctor, what is it?
He suggests that you need a treatment called steroid. Have you ever heard about it?
No, doctor. So if he suggested a steroid, you can give it now.
Mm. Yes, we will admit you for now, and we will start you on a IV medication. IV, I mean by this that the medication will be given through your uh, blood channel to fasting the effect.
Okay, doctor, you are telling that I need admission and giving the medication, and is it a very serious medication? You have told
Uh,
steroid.
this steroid is it's uh, it's not serious. It's not serious, but it is in the same time. Uh, it is important medication for your condition. That in your condition, the your disease came uh, uh, with very severe flare up. So you need this big gun to to reduce the effect of your disease. It help you to reduce all your symptom. Your pain in your hand and joint will improve, hopefully, and we will follow up you during this time. And the same time, this medication, every medication have its own side effects, but it will be given for very short period, for specific period to reduce the unwanted effects. The unwanted effect include that disturb the blood sugar, disturb the blood pressure, maybe causing some thinning in the skin, and maybe it increase the weight a little bit. But you will be under observation and follow up, and we will treat all condition on time. Is that clear so far?
Okay, doctor. Then how many how much injection I will need to take?
This it will be. We will sit you again with your
120
doctor. We'll sit you with the doctor and we'll tell you the specific time for this treatment, and it depends on your response to the treatment and the follow-up. Any other concern you are having?
You have told everything, but will this affect my any other condition, or will it cure my condition?
It help to control your symptom, and you will be with follow-up to reduce all the unwanted effects.
Okay, doctor, that is a good news. And will it cure my condition?
Your condition, sorry, it's not curable, but we can control your symptom.
Okay, that is fine, doctor. Then you can go for it.
Okay, thank you, Mrs. Selena, and we'll sit you
Sign off.
again to update you.
So in this
Thank you.
setting, yeah, you have described everything with just one thing that I'm talking that when you're telling that intravenous injection of steroid, that first you should have told that you have gone very well till now, till this point, that do you have any idea about steroid? No. Okay. Actually, this medication that reduces the unwanted products in the blood, so that your symptoms will be reduced after taking this injection. Do you get me? Okay.
Yes.
Also, it will give you a short relief, and it will stop the progress of your condition now.
Mm.
Okay. It will reduce the progression of your condition. Okay. And after that, do you have any question? You have given all the information at a time. Its side effects, its good effects. Yeah, and after that, if I asked, I would certainly ask that, okay, does it have any bad effects? Does it have any side effects? Then you could have uh, tell told me out. Otherwise, you should have taken the permission before taking these side effects. Okay, certain patients don't want to know the side effects because they are afraid of that.
Mm.
Okay. Otherwise, your explanation, everything was fine. And what is the task? To just try to go task the task as soon as possible after just initial confirmation and initial talking. Just try to, because it will you will not get much time.
Mm. It seems that time is an issue here.
Time is the issue, and for this you will go to the main task as soon as possible, because patients
Mm.
will ask a lot of questions.
Mm.
And like steroid, first you should have give importance that why steroid is important at this stage, because you have increased those symptoms despite taking those medication. That means that the bad products in your body have increased too much, and we need to give this injection. This will reduce the bad products in the body that will improve your symptoms, and also this will reduce the progression of your condition. So this is very necessary for you,
Mm.
so that I will get importance. And after I didn't get time to ask you that do you have any other alternative after taking the bad effects, because you are running out of time. Okay, if I ask you
Okay.
that do you have any other alternative, what would be your answer?
Do you have any what?
Do you have any other alternative?
Alternative? Alternative. Miss Selena, I appreciate your concern. This medication is the best in your condition and prescribed by your consultant. If you don't want it, there is alternative, but it is not effective like this medication. Alternative include lab, and it will be decided by the consultant.
Okay, that is a very good explanation, but I couldn't ask you because you are running out of time. Okay, it is a must question that patient will ask. Surrogate will ask you any alternative. Do you have any alternative? Okay, so
Maybe I talk more than listen, right? I should give chance to surrogate to talk
yes,
also,
yes,
right?
you should have given
I
time.
should shorten my answer, right?
You should have given you just try to shorten the answer and be more specific, and whenever it is written the importance of steroid, that is you should have told her in that way that she thinks that it is the money, it is the best and only option to get rid of her symptoms. There are options, but that will not bring so good.
Mm.
So you emphasize on that, and whenever you are emphasizing on that, try to give some pressure on that, or try to give expression that you are telling her importantly, so that examiner and candidate will examiner and surrogate will understand, yes, she is emphasizing on that, and try to go to the main task as soon as possible.
Mm-mm. Okay.
Okay, I'm going to for the next page. Okay, start.
Mm. Hello,
Hello.
this is Dr. Gabra, the doctor in the rheumatology inpatient department. Are you Miss Selena, 35-year-old?
Yes, doctor, I am.
Well, I understand that you have a condition called systemic lupus erythematosus,
Yes, doctor.
and you were admitted here for treatment with steroid, and we are planning now for discharge.
Yes, doctor.
Uh,
I presented here with so much pain and some problem in my chest, and after taking the medication called steroid, I am feeling now fine, doctor.
I'm glad to hear about that, and your condition was discussed by your consultant, and you are ready, as you said, your symptom is okay, and you are ready for discharge.
Okay, that is the good
And
news.
but
So,
yeah, but
so what do I need to take at home? Can
uh,
you prescribe some steroid tablet for me, doctor?
yes, your consultant prescribed for you a medication called mycophenolate mofetil. Is it a type of medication which can be given by oron? It is type of immunosuppressor medication. With I mean by that medication which suppress the defense system in our body, as your condition is caused by uh, misleading in your defense system. The best treatment for you now is this medication.
Is it a
Do you
steroid
have any question?
tablet, doctor?
It's not steroid. It is another type of medication which control the defense system. It's very important for your condition to keep your disease under control and under remission,
Doctor,
and
I
it
felt
prevents further reaction in your body.
Yes, doctor, I can understand, but I felt very well with taking those steroid injection. Cannot you just prescribe me some steroid tablet? I feel better with.
No, I appreciate your concern, Miss Selena, but as your condition reviewed by your consultant, the best treatment at this time is mycophenolate. We cannot give you steroid any longer because it's a very strong medication and it causes too many unwanted effects.
And your
Are you with
tablet,
me?
yes, doctor, I can understand that your prescribing a tablet doesn't it have any side effect. You are telling that.
Yeah, for sure. Every medication have its own side effects. The side effects include the reduction in our immune system. It can cause some stomach feeling, and you need to plan your future if you want to be pregnant. It should be planned.
Doctor, that is a strange news for me because I thought that I could be pregnant. I could take I could bear a child. That is become impossible for me.
Yeah, we can plan your pregnancy, but you need to sit with your woman doctor and your uh, joint doctor, and they will set the best medication for you. And but your pregnancy should be well planned because this medication can affect your pregnancy.
Okay, doctor, that is very good news. You have told me earlier. And will I need to take this medication for my life? On its
Yeah,
meaning.
yes, yes. This medication should be taken for life unless it's changed by your doctor.
Okay, and do I need any follow up, or just I can take this medication unless I feel any problem?
Sure, you need to be regularly followed up by your doctor. You need regular blood tests, including your blood count.
Okay, that is a good news. You have explained everything well.
Do you have any other concern, Miss Selena?
No, doctor. Just one thing that will this only medication will be able to treat my symptoms, or will I need any other medication?
As long as your symptom is controlled, this is the only medication, and maybe your doctor will prescribe you some medication which control your pain
Time
if you
up.
have pain. And you should have.
Time up.
Okay.
Okay, thank you. This you have explained everything in a very organized and in a very good way. That was very fine. That whenever patient was insisting to take some steroid tablets, you have convinced her in a very good way that taking those steroid medication for a long time will bring bad effects. Rather, taking this medication will improve her symptom, and also this will this medication have less effect, less side effect. The one thing that you have uh, mentioned that about her pregnancy. If you haven't mentioned it, I will I would ask it that I want to be pregnant and will it affect my condition or not? That was a question.
Should
And
I mention it by myself or I should wait for the concern?
okay, you can whenever asking whenever you are telling the good points, and after that, okay, this medication comes with some side effects. Also, do you want to know that? Okay, as this
And the
condition.
follow-up only CBC and there is other.
Okay,
other
okay. It is not our task, and we are not uh, consultant with that. So we will ask after that. We will make an arrangement with follow up, and we will give you instruction that when you should see your doctor, and we will also give you a leaflet so that you can get idea when you have to come up for follow up. And after that, we will again make some assessment of you and may need to do some blood test and other test to see how the disease is under control, and so to see the effect or activity of the medication. Okay, that will give you that you have also told her about follow-up. You haven't told me about follow-up, so I have asked you that. Okay, do I need to take this tablet for lifelong, and do I need any follow-up? And
Okay.
even and in the side effects, you can tell about the microphenol tablet, and the patient have other few concerns, though time hasn't allowed, but you have done everything well. That okay, if I cannot tolerate this medication, what will happen? Will I need to take that steroid tablet again? What would be the answer?
You should come back to the hospital and to meet your doctor, and he will set your plan. Maybe he will stop your medication and give you alternative.
Okay, that is fine. Excellent. So can I go for the next case?
Can I have rest for 5 minutes only?
Okay, then I am taking my uh, dinner because I haven't eaten now.
Okay, take your time.